Did you know that persistent itching in a specific area of the body can be more than just a skin problem? Many older adults live for months with intense itching without an apparent cause, believing it is dryness or age, when in some cases it can be an early sign of a serious internal problem. Today I am going to explain which itching areas should not be ignored, why they appear, and when it is essential to consult in time. Why itching is not always a skin problem. Itching, medically known as pruritus, does not always originate in the skin, nor does it necessarily mean an isolated dermatological problem. Although it is often automatically associated with dryness, allergies, or external irritations, in a large number of older adults, itching can be the visible manifestation of internal processes occurring in the body. Organs such as the liver, kidneys, blood, lymphatic system, and different metabolic mechanisms can trigger itching without any visible lesion, without marked redness, and without response to common creams or usual topical treatments. This lack of clear external signs often generates confusion, frustration, and delays the identification of the real cause of the problem. As the years go by, the body progressively loses efficiency in eliminating toxins, filtering waste, metabolizing substances, and maintaining internal balance. When certain compounds begin to accumulate in the blood, such as bile salts in liver problems, waste products in kidney disorders, or inflammatory mediators in systemic diseases, the cutaneous nervous system can become abnormally activated. The nerve endings of the skin respond to these internal changes by generating a persistent itching sensation, even when the skin appears apparently normal. In these cases, the skin is not the cause, but the channel through which the body expresses a deeper imbalance. In addition, in older adults, the perception of pruritus can intensify due to changes inherent to aging of the nervous system, alterations in circulation, and increased sensitivity to internal stimuli. This explains why itching can be intense, bothersome, and difficult to control, even without visible lesions or clear signs of skin inflammation. The absence of external marks does not mean that the symptom is mild or irrelevant. The most frequent mistake is to treat only the skin, changing soaps, creams, lotions, or sensitive skin products without investigating what is happening internally. This approach usually provides partial or temporary relief, but it does not resolve the underlying problem. When itching is persistent, localized, appears without a clear cause, worsens over time, or does not improve with simple measures, it should not be normalized or attributed solely to age, climate, or skin dryness. In these cases, itching is a signal, not the main problem. It is a way in which the body tries to draw attention to an imbalance that needs to be evaluated. Listening to that symptom, instead of silencing it, allows timely action, ruling out important causes and protecting health in a comprehensive way. Itching areas that require special attention. One of the most important manifestations is generalized itching without rash, especially when it intensifies at night and disrupts rest. This type of pruritus may be related to liver or kidney disorders or blood diseases. When the liver does not properly process bile, or the kidneys do not adequately filter, certain substances remain in circulation and stimulate the nerve endings of the skin. In many cases, itching appears even before other visible symptoms or abnormalities in routine tests develop. Persistent itching in the legs and ankles, especially when accompanied by dark, dry, thickened skin or changes in texture, is usually associated with chronic circulatory problems. However, it can also be related to broader systemic disorders that affect venous return, the lymphatic system, or general metabolism, and therefore requires evaluation and not only local treatment. Persistent anal itching, without a clear infectious cause or improvement with usual treatments, may be linked to digestive, inflammatory, or functional intestinal disorders. In less frequent but clinically relevant cases, it can also be associated with diseases of the colon or rectum, so it should not be minimized when it is chronic or recurrent. Chronic genital itching in older adults that does not respond to common treatments and reappears constantly must be evaluated with special care. Although in some cases it may be related to hormonal changes, dryness, or local alterations, it can also be an early sign of precancerous lesions or local cancers. Ignoring or normalizing this symptom delays diagnoses that, when detected early, have a better prognosis. Another manifestation that should not be ignored is itching localized always in the same spot on the body, persistent for weeks or months, especially when it appears without visible lesion or apparent cause. This type of pruritus may be related to neurological alterations, nerve compressions, or internal processes that have not yet produced other clear symptoms. Consistency in the same location is an important signal that warrants investigation. When itching may be related to cancer, it is essential to be clear and responsible from the beginning. The vast majority of itching cases are not related to cancer. Itching is a very common symptom, and in most people is due to benign causes such as dry skin, allergies, irritations, or hormonal changes. However, in older adults, persistent, unexplained itching that does not respond to simple treatments deserves a deeper evaluation, because in a small percentage of cases, it can be an early sign of more serious diseases, including certain types of cancer. Some hematologic cancers, such as lymphomas, can initially manifest with intense, generalized itching, without visible skin lesions and without marked redness. In these cases, the skin may look normal, but the itching is deep, bothersome, and difficult to relieve, even with antihistamines or creams. This happens because certain substances released into the blood stimulate the nerve endings of the skin. There are also cancers of the liver, pancreas, or bile ducts that can cause pruritus before more well-known symptoms appear, such as pain, jaundice, yellowing of the skin or eyes, or noticeable changes in urine and stool. In these situations, itching does not originate in the skin itself, but in the accumulation of substances that the body cannot properly eliminate and that circulate in the blood. The skin then acts as a warning organ of an internal imbalance. It is important to understand that the key is not to panic or automatically think of cancer, but not to ignore a signal that persists over time without a clear explanation. The body rarely shouts immediately. Many times it whispers first. When a discomfort lasts for weeks, does not improve with usual measures, and has no obvious cause, it deserves to be listened to carefully and evaluated appropriately. Warning signs that should not be normalized: intense itching that lasts more than 2 or 3 weeks without an identifiable clear cause, itching that worsens at night, interrupts sleep, or causes frequent awakenings, persistent itching without visible lesions, without significant redness, and without relief from common creams or usual treatments, itching associated with involuntary weight loss, extreme fatigue that does not improve with rest, night sweats, persistent low-grade fever, or marked changes in appetite. Itching, localized always in the same area, that does not cycle, does not disappear, and is not explained by friction, allergy, or infection. When these signs appear in isolation but persistently, or especially when they combine, medical consultation should not be postponed. Evaluating in time does not mean that a serious disease exists, but it does allow important causes to be ruled out or detected at early stages, when management is more effective and prognosis is better. When to seek urgent consultation. It is essential to seek prompt consultation when itching is accompanied by other signs indicating that the origin may not be in the skin, but in an internal problem. The presence of yellowing of the skin or eyes, known as jaundice, is a clear sign of possible liver or biliary alteration and should never be ignored. Evaluating in time does not mean that a serious disease exists, but it does allow important causes to be ruled out or detected at early stages when management is more effective and prognosis is better. When to seek urgent consultation, it is essential to seek prompt consultation when itching is accompanied by other signs, indicating that the origin may not be in the skin, but in an internal problem. The presence of yellowing of the skin or eyes, known as jaundice, is a clear sign of possible liver or biliary alteration and should never be ignored. Likewise, the appearance of dark urine, pale stools, persistent swelling, unexplained bleeding, prolonged fever, or abdominal pain associated with itching requires immediate medical evaluation. It is also important to consult without delay if itching appears in people with a personal or family history of cancer, liver disease, kidney disease, or hematologic disorders. In these contexts, persistent itching can be an early sign of reactivation or progression of an underlying disease. The sooner it is evaluated, the greater the chances of detecting the problem at an early stage, when treatment options are simpler, less invasive, and more effective. Early evaluation does not mean assuming the worst scenario, but responsibly ruling out serious causes. Many tests and studies can confirm that there is no serious disease, which also provides peace of mind. But postponing consultation, normalizing the symptom, or self-medicating can allow a treatable condition to progress unnoticed. Itching is not always something minor. In older adults, the body rarely gives abrupt warnings at the beginning. Many times it speaks quietly, with subtle but persistent signals. Listening to those signals is not being afraid or exaggerating. It is being aware and caring for one's own health. Detecting it early can make the difference between a controllable problem and an advanced disease that limits quality of life. Now tell me honestly, did you know this information? I read you in the comments. And if you got this far right, I listened to my body, because yes, health comes first.